This program has many unique features to take advantage of as a cardiac anesthesiologist. The Department of Cardiac Surgery is well known across the world for innovative surgeries for heart failure and valvular abnormalities, and so you'll be working with the best and brightest in the field of cardiac surgery.
What is really unique about our program is that it offers not just coronary artery bypass surgery opportunity to our patients and to our learning crew, but also the opportunity to do all the minimally invasive valvular procedures. We offer surgery to patients with heart failure, so the mechanical circulatory assist devices that you have on the chart anywhere in the world are available out here, which includes impellers, Protect Duos, the ECMO capability, and so our team has got all of this training and the capabilities to provide this to our patients. So it's a very well-rounded program. In addition, of course, we manage to help patients with atrial fibrillation and put in clips in them, or the Watchman procedure, or Crescent, for example, that we use for patients on ECMO. So anything that's on the market that is new, we have it. We are very innovative. We offer this opportunity to our patients, to our training crews. It's a wonderful team that is very well trained and well-rounded.
Our faculty here is excited to start this fellowship. It's something we've wanted to do for a really long time. We come from a variety of backgrounds, interests, and experiences from all over the country. One of my favorite things about our program is our relationship with the cardiovascular ICU team. It is staffed by critical care physicians with backgrounds in anesthesiology and emergency medicine. We've worked really hard to cultivate this relationship as a continuation of care to make fluid transitions and system improvements. Their passion for patient care and medical education is really inspiring. I love working with them, and I know you will too.
So I think this place really stands out because you have a caring, dedicated staff, and they are going to make sure that you are the best trained cardiac anesthesiologist when you leave here. Open to feedback, willing to go above and beyond to make sure that you receive excellent training. You are going to be very impressed by the dedicated staff that you'll find here at the University of Louisville. We have some of the best cardiac surgeons in the world. They are the easiest surgeons to get along with. I've never had a greater relationship with a cardiac surgeon than here at University of Louisville, and I think you'll be impressed.
This program, we are planning to help develop a full range of cardiac anesthesiologists, be it if somebody chooses to go into private practice where they're going to be doing more solo cases, or if they want to have a more supervisory role where they're going to be teaching. There will be plenty of opportunities to teach residents, as well as working with CRNAs and supervising CRNAs to get that experience and exposure as well.
I think the breadth of experience and the different case complexity and diversity that they'll see is definitely going to be adequate, more than adequate for training. As well as they have really unique TTE and TEE training months, so you get to learn transthoracic as well as transesophageal echocardiogram, and I think that transthoracic component is actually exceedingly important. And then having both the ability to be the sole in-room provider for cases as well as a supervisory role, because I think a lot of times fellows don't realize how important interacting with others is in the OR setting when you are the attending anesthesiologist. It's actually one of the most difficult things in medicine once you've learned the medicine.
Our program offers a wide variety of cases. We have open heart cases, transplants, percutaneous, robotic, electrophysiology, and structural heart. In addition to this, we have a wide spectrum of heart failure management cases, including, again, transplants, but also VADs, ECMOs, impellers, and most recently, total artificial hearts.
Louisville's a really special city. It's honestly something that you've probably never even considered moving to a city like Louisville, but once you get here, you'll see why it's so special. Number one, the food is excellent here. If you're a foodie, this is a place that you want to be. It's easy to get around. There's an international airport, and we're close, within a few hours driving distance, to many exciting cities like Indianapolis and Cincinnati and Nashville, St. Louis. It's really accessible to get around. The cost of living is wonderful here. It's really easy to live in a reasonable distance from the hospital, easily within 10 or 15-minute commute to work here. So if that's something that's important to you, definitely check us out for that reason as well. There's lots of sports and entertainment to take advantage of here. The University of Louisville is the home team, and you'll know that as soon as you get here, because everything is about University of Louisville.
The restaurant scene is phenomenal, actually. Given the pandemic, there's only so much you can do. But I also like to do a lot of outdoorsy stuff. So there's plenty of parks, a lot of walking. So this city's great.
So what's really nice is that anywhere in the city is about 15-20 minutes drive at most, no matter where you're at. They've got a thriving downtown area that they're actually putting a lot of money in to revive.
So Louisville is a great combination of Midwest friendly and Southern hospitality. We have a large variety of interests. It's large enough to support that, but it's small enough to learn quickly and get around easily.
I have been at the University of Louisville for 8 years. I plan to just be here for 3 years and then kind of move on, just like most people do when they take their first job. But I have loved every minute of being here. Cardiac surgery department is awesome to work with. The cardiac anesthesiologists have been trained by the best and are the best, and are really building a wonderful program here at University of Louisville.
What's kept me here is the fact that the patients that we deal with are with great comorbidities. Unfortunately, that is not good for the patient, but it allows us to use our skills. It allows us to feel very satisfied at the end of the day, that as a team, and that's important, that we have a very collaborative relationship with our team members, and that allows us to provide excellent care to our patients.
I've been an attending here for over 10 years. I love it for the variety of cases, the opportunity to teach, and also our relationship with the cardiothoracic surgeons and the cardiovascular ICU team.
The big reason why I came here is that I wanted to have the opportunity to work with residents, as well as be a part of this fellowship that we are starting, so that I could be a part of something that's being built from the ground up. I get to be a part of being in the driver's seat, along with my other colleagues, as well as developing young anesthesiologists and young cardiac anesthesiologists in the residency and the fellowship program.
We have a thriving cardiothoracic surgical and anesthesia specialty at Jewish Hospital currently, and I can only foresee that growing. I'm really excited about the new fellows coming in and being able to educate them, as well as kind of helping them along and finding themselves as the soon-to-be cardiothoracic attendings that they're going to be. And continuing to grow out the heart transplant, lung transplant, LVAD volumes that we use, as well as the total artificial hearts that we're now performing.
My goal for this fellowship is to create an opportunity here at University of Louisville to advance both patient care and medical education. My goal is for you to leave here as a highly trained, well-skilled cardiothoracic anesthesiologist.